Thank you very much. In medical rounds for you at 5:30 as hospitalizations from COVID-19 trend downward here in Connecticut. What's next for us as other states in the South and West spike? Channel 3's Kara Sunland talked with Jeffrey Flaks, the president and CEO of Hartford HealthCare.
How are you preparing for a potential uptick in cases here, and do you foresee that?
Well, Kara, I think Connecticut, the reason we're having the success we are, the reason the prevalence rates are falling through the significant testing we're doing is because we've taken the right precautions, we've put good policies in place, there's been great adherence to it. So I think in many ways, when you see the disparities now that start to exist across different states and different parts of the country, it really does come back to the approaches different communities have taken. And I'm really proud of the work we've done. And to your point about do we envision it could come back, my answer is if we contain what we're doing today with the policies, procedures we've put in place, for the foreseeable future, we should be, I think, in very good shape. But as we look into the future, there is great risk when we think about the winter and the convergence of the regular flu with the potential for COVID-19.
Yeah, we're not out of the woods. So just about a year ago, it was announced that you would be named the new president and CEO of Hartford HealthCare. Quite a year. What's that been like for you?
Well, it's a tremendous honor to lead this organization. We have amazing people doing amazing things here and heroic work. It's been an incredible year. To have this event occur with COVID-19 in my early tenure as the CEO, you have to throw the book out when you lead during a time like this, and it's been an incredible experience. But being part of this organization, the culture, the values, the traditions, it's an enormous privilege.
So looking back, hindsight's 20/20, but looking back, would you do anything differently?
You know, it's an interesting question, Kara. When I think about looking back, there are examples today. When I look at the early days of testing, when we were restricting it to people who were symptomatic and who were in high risk and vulnerable populations, or we were amongst the earliest systems in the country to give a mask to every staff member, and at the time that was a very big decision to make because we were concerned about the future access to more masks. Now, knowing the masks that are as available as they are, knowing that we were able to structure the partnership nationally with Quest that we did, that gave us so much testing capability, I would have done more faster. But with the facts that we had at the time we made those early decisions, it's hard to say because we had to be protective of this community and we had to make sure that we were preserving those resources because there were so many unknowns.
Jeff Flaks, CEO of Hartford HealthCare, always good to be with you. Thank you for being here.